but that's rare. Yes, there are those with swellings, which swellings may be cancerous or not cancerous. We take off a small piece and test it, and if it's not cancerous, we operate, and usually that leaves a defect. That defect has to be reconstructed. We usually repair. If it's on the soft tissue, we do it. On the bone, we do it. If the bone needs replacement, we get implants and put, and that's reconstruction generally. Sometimes we also get from the body parts, like from the leg or from the hip, and we put it in, we call it reconstruction. There are those who come with severe damages, soft tissue lost. We work hand in hand with plastic surgery for reconstruction. We have the manpower really. The tools, some equipment may be missing, but you as Ugandans, we tell you it can be purchased and brought, and we do the work. The only input we need is for more specialists. At the moment, we intake for training is every other year, because we are limited, having with a few supervisors. So and the instruments are not enough. So we would encourage them to work hard and join us. This is a specialized course which takes 4 years. And we encourage them to work hard and join us. We started it, I am actually a pioneer. We started as 3. With 3, 2 gentlemen. Dr. Komakech works in Lacho Hospital. Dr. Chikamwes works in Naguru. I was the only female. So we were the first Ugandan trained maxillofacial surgeons. Since then, the curriculum was reviewed, and the intake is increasing with time. We started at 3, now there are more than 5. We are encouraging the young ones out there to come and work.
Inspiration can be born from the harshest of realities. For Dr. Adrama Richard, a former UPDF officer, the frontline injuries he witnessed during the Somali War ignited a passion that would change countless lives.
After I did my degree course, I went to Mogadishu, where, because dealing with the forces, there are these injuries which you can expect anytime. So there are many of our soldiers who have been facing a lot of challenges. They got a lot of injuries on the face, even jaws, and also other areas. So most of these people have been referred to Nairobi under UN care. And those minor cases, they refer them back to Uganda. So there are many cases, despite the UPDF cases, but there are also other road traffic accidents which happen many times, as I told you earlier. So these cases are not, you need expertise knowledge. So I had to apply and come back for oral and maxillofacial surgery to address the knowledge gaps, so that we can be able to offer quality medical care to such patients. So these are like, if we say trauma, these are like people who get accident, they get broken bones on their face, jaws, and because our area of concern is usually the face and the jaws. So we find that the bones on the face can be getting broken, and some of them may be around the eye, which may be pressing on the eye. And then when we come to the tumors, basically the tumors are just swellings. They are basically swellings. They find someone's jaw starts swelling without any obvious reason, not even accident related or anything. So you find the jaw starts swelling slowly, which gradually increases in size, and it reaches a size where the person is unable to eat and talk. And also sometimes the bone itself can even get broken during that process because the tumor eats the bone off. And then there are those ones where the swelling can contain inside fluid, a tooth which is coming out because there is a line, they have those coatings. That's coating now, the fluid accumulates inside, which they call the mesh. So when the fluid is there, it prevents the tooth from coming out, which we call the digital cyst. So in that case, the tooth will not come out, the jaw keeps on being expanded, the fluid keeps on enlarging and displacing the bone. And those are the cases we usually manage. So for the fracture cases, we can either do in the clinic, or more severe cases which are displaced, which have all been broken, sometimes we do them in the theater, which we do what we call the orifice, or where we put the plates. The first challenging case we handled was when I was still in internship and I'm undergraduate. It was called, there's a case for rhabdomyosarcoma. It's a tumor of the muscles. It was on the right side of the jaw. With my senior, we had gone that time, we operated. We removed half of the jaw. And this guy, the following day, when we came, we found he was still having bleeding. So we monitored the bleeding from the morning. When it reached around in the afternoon, around 3, 4, it was intensifying. We had to go back to the theater. And we ended up finishing the process, the program, the theater program, up to 1 a.m. at night. So it was my first challenging case, which we did. Then the second one was also a tumor, which is called ameloblastoma. There is a lady who was referred from Ginger. It was in social media. We worked with one of our professors, Dr. Kamregia, and the tumor had already eaten all the jaw. The whole jaw was 5 kilograms. So that tumor, now we had to remove the whole jaw down. So this lady, actually we monitored her. The following day, actually she was doing well. After a week, she was discharged. These patients, they first go counseling. They come with these cases. During our interactive stages, we usually assure them they're not actually the first people who come around. Many people have come here the same. They have gone through the same processes. And sometimes, because even their cases they are more worried are even less than the ones we have already managed, we assure them of the success after the operation. We counsel them, we tell them what is supposed to be done, the outcomes, and how the person is supposed to cope up with the after effects of the results of the tumor or the accidents. It's one of them. Then we also do investigations to make sure that they don't have other limitations, which may be chronic sicknesses or other heart problems which may be there. So when they are properly investigated, we prepare them for the surgeries. Now there are many complex diagnoses. We usually have them here. So patients usually, as we say, we after the investigation, especially the CTs and the required information when we get, we usually come and tell them the nature of their sicknesses and the outcome if we do surgery or something else the outcome, how it will be. But of course, now we usually go for them for definitive management. Definitive management is the treatment which we know can be able to help the patient. Now, if the patient is nature of the disease involves cutting part of the jaw, we have to inform them and the preparations they need in order to do, and also the outcome is there's going to be a defect because of this and that.
For many Ugandans, life on the road comes with unforeseen risks. One such risk turned tragic for a local border rider whose life was nearly shattered by an unprovoked attack.
Attacked by robbers during a scuffle. They hammered him in the face. He fractured his jaw and even injured his head. He remembers the pain, the fear. But here at Mulago, the doctors worked miracles. He's now being discharged and we feel grateful. He is alive. I had heard about people having to fly abroad for such treatments, but I was amazed that here in Uganda, I received top-notch care without spending a fortune. I owe my second chance to these heroes.
Another story unfolds. A motorbike accident that left a young man with a deformed jaw. His journey towards recovery is about to begin.
After my accident, I was devastated. I thought I had to go abroad to fix my jaw. But here, I learned that Mulago can provide the treatment I need, free of charge. I'm scheduled for surgery soon, and I feel hopeful. I trust in the expertise of our local doctors and the advanced facilities available here at home.
For years, the narrative was that the best care could only be found abroad, a costly journey both financially and emotionally. Yet, as we have witnessed, Mulago Hospital delivers world-classic maxillofacial surgery right here at home. The need to fly overseas for treatment is diminishing as our local experts continue to raise the bar in medical excellence. From the scars of violence to the triumphs of modern medicine, Mulago Hospital stands at the forefront of maxillofacial surgery, a symbol of hope and national pride. Today, we witnessed how cutting-edge treatment and unwavering dedication can transform lives, from proving that world-class healthcare is not a privilege for a few, but a right for all Ugandans. This is Uganda Broadcasting Corporation, bringing you stories of national importance.
UBC, inspiring Uganda. This week on UBC.
The culture of the school was different regions would converge together.
Oh, okay.
So you find West is converging, East, Central, and North. You would even invite a prominent person from your region.
Like your MP, your
Like
LC.
your MP. I remember during our time, we invited the king.
Wow.
Yes.